Ever wondered how adrenal insufficiency is diagnosed and treated? Adrenal insufficiency, a condition where the adrenal glands don't produce enough hormones, is an essential topic in the medical world. Understanding its diagnosis and treatment is crucial to managing the health of those affected. This condition can severely impact an individual's health, causing a range of symptoms that can compromise their quality of life. Today, we will delve into the intricacies of adrenal insufficiency diagnosis, treatment, and management. So how do healthcare professionals go about diagnosing adrenal insufficiency? Let's dive deep into the diagnostic evaluation for condition. The diagnosis process essentially involves a series of diagnostic tests. It all starts with the measurement of cortisol levels. Our body's stress hormone is integral to numerous vital functions. Low levels of this hormone can suggest adrenal insufficiency, but this alone does not provide a definitive diagnosis. This is where the ACTH stimulation test steps in. ACTH, standing for adrenocorticotropic hormone, instructs your adrenal glands to manufacture cortisol. In this test, a synthetic version of ACTH is injected into the body, and the response of the adrenal glands is monitored. Reduced cortisol production suggests possible dysfunction of the adrenal glands, an indicator of adrenal insufficiency. But the investigation doesn't end there. Imaging studies come next. Now you might be thinking, why image studies? Well, adrenal insufficiency can stem from issues in different parts of the HPA axis, the hypothalamic pituitary adrenal axis that regulates our body's response to stress. The adrenal glands, pituitary gland, and hypothalamus are all crucial components of this system. Therefore, imaging studies like MRI and CT scans can shed light on any structural abnormalities with these organs that may be the root cause. This can certainly be overwhelming, however, bear in mind that each test plays a vital role. Cortisol level measurement provides the first hint. The ACTH stimulation test evaluates the adrenal gland's function, and imaging studies reveal any structural issues in the HPA axis. Each test contributes an essential piece to the diagnostic puzzle. Correctly diagnosing adrenal insufficiency is much like a complex jigsaw puzzle where each piece holds equal importance. The appropriate tests can drastically improve the diagnosis of adrenal insufficiency. With a detailed and robust diagnostic evaluation, healthcare professionals can decode the answers required to devise effective treatment and management strategies for patients with adrenal insufficiency. After diagnosis, the focus shifts to treatment options. Adrenal insufficiency is a condition that needs continuous management, with the primary goal of treatment being to replenish the deficient hormones, predominantly cortisol, and to restore the hormonal equilibrium within the hypothalamic pituitary adrenal, also known as the HPA axis. The most frequently used treatment strategy is glucocorticoid replacement therapy. Glucocorticoids, a kind of steroid hormone produced by the adrenal glands, are significant in many bodily functions, including the immune response, metabolism, and stress management. When the adrenal glands aren't producing sufficient amounts of these hormones, replacement therapy is employed to compensate. Medications such as hydrocortisone or prednisone are commonly used in this form of therapy. Hydrocortisone is the most similar to the natural cortisol produced by the body, making it the preferred choice for treatment. Prednisone, however, is often chosen due to its extended effects. Alongside glucocorticoids, some patients might also need mineralocorticoid replacement therapy. Mineralocorticoids like aldosterone help balance the body's salt and water levels. For those with primary adrenal insufficiency, where the adrenal glands themselves aren't working correctly, a medication like fludrocortisone for mineralocorticoid replacement therapy is frequently required. This medication assists in maintaining blood pressure and fluid balance by mimicking the action of aldosterone, but it's crucial to remember that adrenal insufficiency is not a static condition. The body's cortisol requirement can vary, particularly during periods of stress or illness. As such, patients might need to adjust their medication dosage during these times, a practice known as stress dosing. It's vital for patients to discuss this with their healthcare provider, as excessive cortisol can cause side effects, while too little can result in an adrenal crisis, a severe and potentially fatal condition. Naturally, each treatment plan will be specifically tailored to the individual patient. considering their unique form of adrenal insufficiency, their overall health, and their lifestyle. Regular consultations with healthcare providers are essential to monitor the effectiveness of the treatment and adjust dosages as necessary. It's also crucial to remember that while these therapies can help manage the symptoms of adrenal insufficiency, they are not a cure. Patients will need to continue treatment for life. However, through careful management and the right therapeutic approach, most individuals with adrenal insufficiency can lead normal, healthy lives. With these treatment methods, adrenal insufficiency can be effectively managed. But always remember, it's a collaborative effort. Open and ongoing communication between patients and their healthcare providers is the key to achieving the best possible outcomes. But the battle doesn't stop at the treatment. The strategy for managing life with adrenal insufficiency is also imperative. Picture a maze with no guidance. That's what dealing with a medical condition, like adrenal insufficiency, can feel like without the right game plan. It's beyond the treatment. It's about understanding the condition, tracking changes, and being ready for potential crises. The first and most vital is educating the patient. As they say, knowledge is power. And in the case of adrenal insufficiency, this statement rings incredibly true. Patients need to comprehend their condition, the significance of their medication, and the potential repercussions of neglecting it. They should be able to recognize the signs of adrenal crises, like severe fatigue, abdominal discomfort, and low blood pressure, and know the proper response. But comprehension is only half the war. The other half is about constant vigilance. Regularly monitoring symptoms and hormone levels can give early alerts of an impending crisis or imply that a treatment adjustment may be required. This isn't a once-a-year checkup scenario. It's a continuous and ongoing process, much like checking the weather before heading out for the day. And speaking of weather, as we all know, it can change rapidly. The same goes for adrenal insufficiency. Stress, illness, and even physical exertion can set off an adrenal crisis. That's why it's so important to be ready for these sudden storms. This brings us to the indispensable emergency kit. Consider it as the umbrella in our weather analogy. It's something you hope you'll never need, but you'll be thankful to have when the storm comes. An emergency kit should have injectable hydrocortisone, which can be a lifesaver during an adrenal crisis. It's like carrying a personal emergency room in your pocket. But why injectable hydrocortisone, you might ask? Well, during an adrenal crisis, the body may struggle to absorb oral medication properly. Injectable hydrocortisone bypasses the digestive system, delivering the medication directly into the bloodstream. It's a quick, efficient way to counteract an adrenal crisis and stabilize the patient until they can reach a hospital. To conclude, the management of adrenal insufficiency involves a multifaceted approach. It's about educating, constant vigilance, and preparation. It's about understanding the maze and having a map to navigate it. And primarily, it's about empowering patients with the knowledge and tools they need to manage their condition effectively. With the right game plan, adrenal insufficiency can be managed, and patients can lead lives filled with fulfillment. Adrenal insufficiency is a complex condition with varying intensities. As we've ventured into this subject, we've witnessed how essential diagnostic evaluation is in pinpointing the condition. This entails checking cortisol levels, conducting ACTH stimulation tests, and examining the structural soundness of the adrenal and pituitary glands, aiding healthcare professionals in precisely identifying the problem. Subsequent treatment strategies are then framed based on the intensity and variety of adrenal insufficiency. Glucocorticoid replacement therapy with drugs such as hydrocortisone or prednisone, mineralocorticoid replacement therapy with fludrocortisone, and stress dosing during periods of illness or elevated are all effective alternatives. However, treatment forms only a section of the scenario. Efficient management of adrenal insufficiency necessitates patient awareness and vigilant monitoring of symptoms and hormone levels. It also requires vigilance for possible adrenal crises, which can be fatal if left untreated. In conclusion, adrenal insufficiency encompasses primary, secondary, and tertiary forms, each characterized by dysfunction at different levels of the HPA axis. By understanding the underlying mechanisms and associated hormone imbalances, healthcare professionals can effectively manage this condition, improving patient outcomes and quality of life. We can assist patients to manage their condition effectively, and ultimately lead healthier, more satisfying lives by understanding adrenal insufficiency in its entirety.